Welcome to our guide on post-operative care following gum grafting surgery. It's crucial to follow these instructions to ensure a smooth recovery and minimize complications. Let's start with some essential tips to protect the surgical site. Protecting the surgical site. Avoid stretching your lips with your fingers to the surgical site, as this can cause trauma and introduce bacteria to the surgical site. Keep your head elevated at all times, even during sleep, by putting 2 pillows behind your head for the first week. Do not eat, drink, or sleep with gauze in your mouth to prevent choking hazards. Plastic shield and stent, if applicable. Please do not remove for 24 to 48 hours following surgery. It's normal to spot blood for the first 24 hours. Contact the office if bleeding is extremely heavy. Replace gauze every 20 to 30 minutes until bleeding stops. If your mouth continues to fill up with blood, remove the stent and apply firm pressure for 20 minutes. Once it stops, place stent back in for 24 hours. Wear the stent provided at all times during the non-removal window to protect the roof of your mouth, especially while eating and drinking liquids. After your 24 to 48 non-removal window, clean the stent each time you remove, especially after eating, using a mouth rinse or toothbrush. The more you remove the stent, the more trauma that could be done to the roof of your mouth. Most patients wear the stent for the first week and then discontinue. Do's and don'ts. Do not swish or spit aggressively for the first 24 to 48 hours, as we want to maintain the blood clot over the healing site. Do not floss in the surgical site. Do not drink alcohol for 1 week. It can interact negatively with medications. Do not smoke for 1 to 2 weeks, as this can hinder healing. Do not touch the gums and put pressure on the gums in the surgical site until complete healing, 4 to 6 weeks. Do's. If Stellalife Recovery Pack was given, use as directed on the side of the box, using the head tilt roll technique. If chlorhexidine was given, use 2 to 3 times a day for 1 week. Stop after 1 week, it can stain teeth. Continue normal brushing in all other areas with your standard toothbrush device. Only use the soft toothbrush on your grafted surgical site. You will start this the day after surgery and use for 1 week. From 7 to 14 days, use a standard toothbrush on your teeth, but do not touch the gums. Resume normal brushing with your standard toothbrush on all teeth after 14 days. For single-site grafts, resume normal flossing after 1 week. For multiple sites, resume normal flossing at 4 weeks post-surgery. Sutures will dissolve on their own within 1 to 4 weeks. Use ice packs externally around the surgical site for 20 minutes on and 20 minutes off for up to 72 hours, at least 4 hours a day, with the first day being the most important. Do not place ice packs inside the mouth. Maximum swelling and bruising occurs 72 hours after surgery. Bruising can have various colors and may travel down the neck or up the cheek as it heals. If swelling or bruising persists after 72 hours, switch to warm compresses. Antibiotics. Complete the full course of antibiotics if prescribed. Discontinue if you develop hives or a rash and contact the office immediately. Expect pain or discomfort after surgery. Follow prescription instructions for pain medications. You may take the narcotic and Motrin together if prescribed. Get adequate rest. Avoid strenuous activities and heart rate elevating activities for 3 to 5 days. After the first 72 hours, you should start feeling better each day. Wear oral appliances only after adjustments by your provider. Bring your oral appliance to surgery for necessary adjustments. If your appliances puts pressure on your gum tissue, it can lead to failure. Avoid excessive talking, smiling, or stretching facial muscles post-surgery to prevent tension in the surgical site for the first 24 hours as much as possible. For the first 24 hours, consume cold or room temperature soft foods only. After 24 hours and up to 14 days, introduce lukewarm, mushy foods. Avoid nuts, seeds, berries, crunchy foods, and hard bread for 1 week. Minimize extremely spicy and acidic foods. Chew on the opposite side of the surgical site, if applicable. Do not use a straw until your post-op evaluation. Thank you for watching our post-operative instructions video. We hope you had a wonderful experience at our office. For further inquiries, please contact us